Welcome to our video series on diabetes and beyond. This video will address strategies to improve diabetes management in long-term care settings. You may watch each video in order or based upon your interest. The objectives of this learning session are to evaluate who is at risk for diabetes and identify the signs and symptoms. There are several risk factors for developing diabetes. Elderly, will always be at a higher risk. Being overweight or having a BMI greater than 25, which is defined as obesity, is a major risk factor. And where you carry this weight can put you at an even higher risk. These are what we consider the big red flags for screening someone for diabetes. Other risk factors include women with gestational diabetes or polycystic ovarian syndrome, individuals at 45 or older, those with a first-degree relative who has diabetes, so a sibling or a parent, a lack of physical activity, so a sedentary lifestyle puts you at risk, individuals that have a history or currently have a non-alcoholic fatty liver are at risk. And finally, African Americans, American Indians, and Alaskan Native Americans are at higher risk. General recommendations are to screen healthy adults starting at age 45 at a frequency of every 3 years. For those who are overweight or obese, they should be screened starting at the age of 35 and may be screened more often based on their individual risk factors. This is in part due to the high estimated numbers of people with undiagnosed prediabetes. A BMI of 25 or higher, meaning obesity, it's the #1 risk factor of prediabetes or type 2 diabetes. Here are some additional risk factors which would lead to screening more frequently. Having a family history of diabetes, history of gestational diabetes, if you have high blood pressure, high cholesterol, don't exercise much, and belong to certain ethnic groups, so Hispanic or Latino descent, Asian Americans, and Pacific Islanders. The U.S. Preventative Services Task Force and the American Diabetes Association recommend screening for type 2 diabetes and prediabetes in asymptomatic adults using one of these 4 methods, depending on the situation. The first is the hemoglobin A1C, and this is a great test for somebody who maybe you're not sure how long they've been running with high sugars, and it'll give you an average of their blood sugar level over the last 2 to 3 months. Next is the fasting plasma glucose test. This requires fasting for 8 hours, no food or drink except for water. Next is the oral glucose tolerance test. This is used in women who are pregnant. You come in, you get a baseline glucose level, and then you drink a sugary beverage, and then come back 2 hours later and you're retested. The last one is the random blood glucose test, and this can be done at any time. And it is usually used when you know for sure this patient is at a high risk and most likely has diabetes. There are many signs and symptoms for diabetes. The 2 biggest are the urine, that frequently urination, and thirst. Huge symptoms. If you're losing weight and you don't know why, if you're always hungry, your vision can be impaired, numbness and tingling in your hands and fingers. It actually diabetes puts you at risk for neuropathy, which is numbness. Lethargy, very dry skin, sores that heal slowly, infections, fruity breath. So in summary, here are some key takeaways from today's presentation. The elderly, particularly those 65 and older, are at a significant risk for type 2 diabetes. Knowing the risk factors and the signs and symptoms of diabetes can help expedite the diagnosis and treatment. Here's a list of tools and resources that you may find helpful to further explore what we've discussed in this video series. If you have questions about this video or others, please contact us at info@superiorhealthqa.org. Thank you.